Hello, this is Child Crest, and it is all about the child. As you know, that we are still running our series on community health, very important for the child development in the society. Our focus on this program is to ensure that we give tips to parents to know how best to nurture their children. Of course, we know that children are our future leaders. Today, we shall be focusing on another interesting topic on community health. I have a very interesting personality in the house. Today we shall focus on toilet habits. Remember that we talked about hygiene, closely related, isn't it? Timileyin is here to tell us what exactly we mean by toilet habits. When we come back, you'll meet my esteemed guests.
On this segment of the program, we are going to be talking on toilet habit. What's toilet habit? Toilet habit is also known as toilet hygiene, in the sense that how do you keep your toilets clean? What are the various things you use to clean your toilet? How do you keep your toilet for you to be safe from diseases, from harmful germs and diseases? For answers to these questions, join me as I hand you over to the guest and anchor of the program.
You're welcome back. The program is still Child Crest. Thank you very much, Timileyin, for setting the pace for us. Join me as I welcome to the studios of Child Crest Dr. Mrs. ADEDOYIN SHOYELE. She is the Principal Medical Officer, Unilag Medical Center. Thank you for joining us.
Thank you, it's a pleasure.
Yes, so what about toilet habits? What do we have to know about toilet habits? Is it important for us to even to know, have habits to relate to the toilet?
Toilet habit is a very vast topic that covers a lot of things and is very important. It covers toilet training in children. It covers even the way we go to the toilet and we utilize the toilet. What we do after we finish using the toilet, how we clean up is very important. All these come under the topic toilet habits. It also addresses some so-called stigma or taboo that people believe is attached to the toilet. So all these are part of the topic toilet habits.
I like the way you have started off. Let's look at the toilet training of the child that you talked about. How best can we train the child to use the toilet?
Well, children differ. Some children are ready to be potty trained as early as 10 months, 1 year old. Some, on the other hand, will take their time and would be about 2.5, 3 years before you can really get them potty trained. And potty training is not a day's job. It's something that it takes a while before you get your child fully trained. Now, potty training involves getting your child to be continent or getting a child to be continent of stooling and urine, to be able to control the bladder, to know, oh, it's time for me to pee or it's time for me to poop, rather than doing it on his body. And it's been said that the best way to do it is by reinforcing the same message to the child consistently over and over. Our grandmothers then would put a baby on the potty several times a day till the baby gets the impression that, oh, I need to do a job. Some would even say, put your child in the potty first thing in the morning so that the child learns to poop. Usually by the time a child is 12 months, going to 18 months, the child can send signals that I want to do the big one. So a parent at that time knows that this child is ready to be potty trained. And you can potty train the child by taking the child to the toilet, reinforcing the habit of pulling down the child's trousers, shorts, skirt, undies, putting the child on the potty seat. Of course, you can always get child at friendly potty seat to put on the main toilet bowl. Putting the child on the potty seat, letting the child express or evacuate himself before you take the child out. And always reinforce the fact that the child needs to wash their hands after cleaning up. So we do this consistently. A child eventually gets the message that I want to do the do, I need to go to the toilet. I need to pee, I need to go to the toilet. And usually over 6 months, 1 year, they get used to it.
Interesting. Well, this is to assume that most children will be compliant. There are some stubborn ones that even if you train over and over again, they still, do not want to, and they decide to just choose to do it on themselves. What's your counsel?
Well, some will say stubborn. It may not be that the child is stubborn. The child may be having some problems with continence. There are some children that even when they've been trained, they still have a little bit of maybe a urinary tract infection going on that makes them pee on themselves. There's some children that they find it a bit difficult to actually learn this toilet habit. We are seeing more of children that are a bit autistic, I would say. So they find it difficult to cope with these social skills. And that kind of child, they would say, oh, he's stubborn, but it's just finding it difficult to adapt. And with consistent training, with consistent reinforcing the message, after a while, the child gets it. The whole idea is not to get frustrated. I have a friend that said when her daughter was 4, she would still poo on herself.
4 years?
4 years old. She would still occasionally poo on herself. And the mother would take time out, take her to the toilet, wash her up and say, you need to go back. And with time, the child got the message. Good. So all children are not the same. We have the ones that will get continent 1 year, they know how, and you have the ones that take a bit of a while to learn to get into the toilet.
Interesting. Earlier on you said our mothers will put the child and put on the potty, and then for a while, I want to believe that that wasn't the period of diapers, nappies, and all that. But now that you have nappies, diapers, how do you still, balance this up? Because some parents will say, just do it inside the diaper. Do it
because the diaper is so convenient for us parents, especially busy parents. Exactly. We don't mind keeping the child in diapers if the child is 3 years old. For us, it's just a relief. But the truth is, we need to get them, because it's also one of the life skills they need to know. So we need to get them into this potty training habit, and we have to reinforce it. When they do well, applaud them, make them feel like, oh, you did marvelously, you went to the toilet all by yourself, fantastic. Children generally like to be thought of as big boys and big girls. I think that's the highest compliment you can pay a child. You tell them, wow, you're a big boy or you're a big girl. Makes them feel good, makes them feel, oh, I'm growing up. And usually they like to do things that will reinforce this message that I'm independent. And when we reward them for getting it right, they tend to want to do more. They're motivated to do it better, to make sure that you keep applauding them for getting it right. So we should just not get tired of it. We should not, in this diaper age, even though it's convenient for us to put them in diapers, we should realize that we are all injuring the child when you keep them too long in diapers too. So we need to learn how to balance it.
Okay, the balance now also comes between the urine and the poo. Are the training is different?
Not necessarily. For most mothers, they can actually tell you that, oh, my child usually poos first thing in the morning, or my child poos twice a day. So for the stool, it's a bit easier to predict when you need to take the child to the toilet. With the urine, it's a bit more difficult. So usually children they become continent with stool first, okay, and then with urine. But as I said, the message needs to keep being reinforced. Consistently. And then you also have to let the child, anticipate that I've taken the child to the bathroom, had a bathroom break an hour ago. I should do another 1 hour and see if the child still wants to go. With consistency, the child gets the message.
Interesting. Dr. SHOYELE is sharing thoughts with us here. Well, we'll be talking about the older children now. How long should they spend in the toilet? So we have some children spending so long, particularly when you know that somehow for economic reasons, maybe just one toilet in a home. Let's take a short break. We'll be back to continue the knowledge sharing on Child Crest. We'll be back shortly. Hello, this is Child Crest.
In the kitchen, when women are cooking, food hygiene goes a long way.
Potty training involves getting a child to be continent of stooling and urine.
The parents feel stigmatized and treat the child differently from how you treat other children.
She is a protector, a giver, and a shield. There's so many things that are being abused.
Herd immunity applies only to contagious diseases.
By making sure we wage war against rodents, You look at the toys that you're going to buy for the child, especially children under the age of 2. You need to look at toys that they cannot swallow.
This community, most of them, they don't use toilets. Most of them, they don't have. They prefer going to the bush. Even me, I've confronted them several. I said, you people should go and use toilets. Stop this habit of entering the bush. Something can happen inside the bush. They said they cannot sit on the toilet. They can't build the toilet in the house. Can you be living with toilet in your house? So they prefer going to the bush. That one can also cause airborne disease, diarrhea, vomiting. So because by the time you have a diarrhea, then your physics is on the floor. Maybe a fly will now come, perch it. From there it will move to your food. Perch your food, you take it. There you yourself can also get that diarrhea.
You're welcome back. The program is still Child Crest. Focus on nurturing the child. Tips for parents to know how best to bring up their children in the society, for us to have healthy and well-groomed children in the society. I still have with us here Dr. ADEDOYIN SHOYELE. She is sharing thoughts with us on toilet habits. The question is,
Yes.
how long must we spend in the toilet? Does it depend on individual or the health status of the person?
How long somebody should spend in the toilet? Well, of course, we assume that when you're going to the toilet to take a pee or to urinate, you're not going to spend a long time because you would be pressed before you go to the toilet. But if your child is going to the toilet to do the poop, or like they say, number 2, and you find out that your child is spending so long in the toilet, you should
Be wary.
check what the poo of the child looks like.
Okay.
Is it very hard? Is the child finding it difficult to actually pass feces? Or the child just goes to the toilet when it's not pressed? Now, if a child is having hard feces or is finding it difficult to pass the feces, then you know that the child may be constipated. And that might be why the child is spending longer in the toilet than usual. And you need to check the diet of the child. Okay, so it's not a time-limited frame. They say that usually if it takes you more than 2 minutes to get your poop out, then there may be a problem. Not necessarily that there is. Okay, we have to make sure that the poop is not too hard, and not that the child is having diarrhea on the other hand too. Diarrhea would be when you have very soft, very watery, in fact, watery stools. If it's not watery, if it's not extremely hard, then you don't need to panic about it. But in a situation where you have a child that is passing very hard feces, there are some children that constipate. Then you need to watch the diet of the child. Increase the fiber the child is taking in the diet. And you can get fiber in foods like oatmeal. Okay? You can give the child vegetables to eat. Children don't like vegetables, but make it interesting. Give the child vegetables to eat. You can give the child fruits to eat. And when we say take oranges, people usually assume that we mean suck oranges. No, we mean eat oranges with the fiber. All this helps the child to pass stools easily. And there's no hard and fast rule that says you must poop every day. There's no rule that says you must poop every day. Some people go every day. Some people go once in 2 days. It doesn't mean that the person going once in 2 days has a problem. So that's part of the things that mothers need to be aware of.
Okay. Now, let's assume that all is well.
Okay.
And some children will just, maybe they just want to be naughty and all that, and they just spend so much time
in the toilet. Yes, that
want
happens.
to truancy and all that. You know, what's your counsel for such a parent?
Some children spend time in the bathroom because they want to go to the bathroom to escape. For example, my friend says when it's time for lesson teacher for her son to do homework, the child says, I need to poop. And the child goes to the toilet and spends 30 minutes. Aren't you done? I'm still pooing. Not because he wants to poo, but it's an avenue for the child to escape. So you need to find out, is the child escaping because the child doesn't actually like the way the lesson is being taken? Or the child is escaping because the child doesn't like schoolwork? The toilet is not necessarily the most conducive place for the child to stay. It's probably playing there. So the mother needs to go.
We're furnished.
So the parents need to go and see if the child actually finding it difficult to poop, or the child is just there playing. Sometimes they go with their tablets in this digital age. They've gone there with a tablet to play computer games where nobody's going to check them, or they're there just doing one thing or the other, just a hideout zone. So we also need to be careful before we say, oh, the child has been spending so long in the bathroom, I'm sure there is a problem. Parents also need to investigate.
Closely related to that is after the child has defecated, urinated, cleaning up.
Yes.
How best should a child or anybody at all clean up after using the toilet?
Well, there are two schools of thought about cleaning up. There's a school of thought of the water school of thought, and there's a school of thought of the tissue paper. Now, both methods, there is nothing wrong with them as long as they are done properly. If you're wiping with the tissue, you always need to inform the child, teach the child how to wipe to make sure that he or she doesn't, well, usually with a girl child anyway, doesn't carry feces by mistake from the anus to the vagina. So you must learn to wipe in a definite mission from front to back and throw away the tissue. And even though we have a flush system, you're not supposed to wad tissue up and clog up your system too. So that's part of the thing you need to tell the child, that the tissue should be moderate quantity, okay, not wad it up to clog the toilet system. Then there's a school of thought of the water. So if the child is cleaning with water, when the child cleans with water, it's the same principle, front to back. And must always remember to wash their hands thoroughly. Let's not forget to teach the children how to flush. We should teach children to flush. Preferably to flush with the lid of the toilet closed down, so that nothing splashes up. It's said that even the bacteria in the hair after flushing is more than you probably would have in the bowl after pooing.
Really?
Yes, that the reflux of the water may make so much bacteria go up. So teach the child to flush with the lid down, okay? And then wash the hands thoroughly with soap and water. Whether the child cleaned with tissue or the child cleaned with water. She has to wash the hands thoroughly with soap and water.
If you're washing with water, how best do you clean, particularly for the girl child too?
How best do you clean for the girl child? If you're cleaning with water, then it's still the same principle.
Okay.
You clean with from front to back for the girl child. Another school of thought says that for a girl child or for somebody who's going to maybe like a shared toilet with so many people, what you could do for the child before the child actually poos or pees is put a little tissue, just maybe like one ply of the tissue paper in the toilet bowl before the person sits on the toilet, just in the toilet bowl, so that there's no flushing of splashing of water. And when the child is cleaning, just rinse with water, the same motion front to back, and make sure that you clean up your hands.
Doctor, let's not take it for granted that, okay, luxury of toilet, maybe there are 1, 2, 3 toilets in a home. Let's assume one toilet for a community, quote and unquote. How do you relate with such toilets that you curtail diseases?
Okay, diseases transmittable through toilets are not much. Contrary to what people believe, because people believe that I've seen people come in, I have a toilet infection. You did not catch the infection from the toilet. It's highly unlikely you're going to catch an infection from the toilet by sitting on it. Of course, nobody wants to sit on the dirty toilet where you can see pee on the toilet rim or something. Nobody wants to do that. So it may be, I always advise that it may be necessary to actually just clean the rim a little before you sit. But if you utilize the toilet properly, you're not likely to catch any disease. The most or the worst you probably would catch would be a skin infection. That's at the very worst. But if you have good skin, you don't have a breakage in your skin, you don't have a compromised immune system, and you sit on a toilet, even if it's a public toilet, you're not going to catch anything. As long as the toilet is used for what it was meant to be used for, you're not likely to catch any diseases. Okay, so just make sure the toilet is clean.
Okay, let's assume that earlier on you said you should cover the lid. Does disinfectants play a role here? Maybe a lot of people are using toilets. You just want to ensure that you just sprinkle some disinfectant, if either before or after use.
You sprinkle disinfectant to clean your toilet anyway. So whether you're sprinkling it before use or after use, I wouldn't advise you to sit on the toilet that has disinfectant in it. Okay. I would say disinfect the toilet, flush it away, sit on the toilet.
Okay. Interesting. You know that we are taking it for granted that, yeah, in fact, all the toilets you have talked about is the
flush system.
Toilet. Meanwhile, there are several others. Yes. In fact, some people still toilet in the bush. We'll talk about that. I've been chatting with Dr. ADEDOYIN SHOYELE. She is a principal medical officer with Unilag Medical Center. Thank you very much for nurturing all the guys and girls there.
It's a pleasure.
Doing a great job. We'll talk about that in the campus life concerning this toilet habit. Let's go over to other segments of the program now. When we come back, we shall be bidding bye-bye. Till we meet next time.
we actually need to promote and prevent any cord death that happens is one too many. In this age, currently, it's not tolerable for the parent to wake up in the morning and find the child dead. It's actually a crime. And a social work department should actually be promoting this all around us. We should also be concentrating on looking at our children that are now adolescent enough, going to school and doing all that activity. You need to start looking at them. Do they have a growing pain? So some of the kids will come and say, oh, my knee's sore after I play sports, after I play soccer and things like that. This is telling us that we need to check on the bone of this patient. Some of the kids will tell, my back is sore, my back is painful. You need to look at that child from head to toe and see, is the back getting what we call scoliosis? This should be checked regularly, and if you have any doubt, it should be a problem. For our young girls that are growing up, you also need to look at their development. Their gynecologic hygiene is very important, and a child girl needs to know from beginning how to look after her. The importance of having a good hygienic program for a child girl as they're going into menstruation age cannot be overstated. This is what they need to be empowered with, because the way they start is how they're going to live their life looking after theirs.
You're still on to Child Crest, and on this segment of the program, we're giving out gifts to well-nurtured children. Our child of the week is Aliamin Adeshino. He's here with his mom. Welcome, ma.
Yes, ma.
And congratulations.
Thank you, ma.
It's really, really fun having
Thank you,
this
ma.
fine boy in our midst. So how has it been, like, taking care of this handsome boy?
It's very nice. I've been taking him for immunization 3 months, 6 months, and 9 months. So the next we are going now is 1 year.
Courtesy Vitafoam as our child icon of the week, we have this lovely chair.
Wow. Thank you very much, Vitafoam.
Yeah, welcome back. Child Crest is still the program. Parents, I hope you are getting tips on the best way to nurture your child. We are enlightening you. All you need to do, particularly the corporate bodies, is to support us on this program so that we can make it endure. Do tune in same time next week when we shall bring you another edition of the program. Until then, bye for now.